When it comes to men's health, few topics spark as much confusion and debate as the relationship between masturbation and the prostate. Online, you'll find videos and articles claiming that masturbation either ruins your prostate or protects it, leaving many wondering what the science actually says. In this explainer, we'll cut through the noise and review what high-quality research shows about prostate cancer risk, prostatitis and chronic pelvic pain, benign enlargement or BPH, common myths, red flag symptoms, and the habits that support long-term prostate health. Let's start with the basics. Does masturbation damage the prostate? Based on current medical evidence, the answer is no. There is no credible scientific data demonstrating that masturbation harms the prostate. In fact, the prostate is a gland whose natural function is to help produce and secrete seminal fluid, and normal ejaculation, whether during sex or masturbation, is part of its biological role. Much of the confusion comes from well-meaning but misinformed sources. Some claim that frequent masturbation somehow wears out the prostate or causes inflammation. But high-quality studies, including those looking at large groups of men over many years, have found no link between masturbation itself and increased risk of prostate disease. The prostate, like any other part of the body, can experience medical problems, but masturbation isn't a known cause. Let's talk about prostate cancer, a concern that often comes up in these discussions. Prostate cancer is one of the most common cancers in men, especially as they age. What does the research say about its relationship to ejaculation frequency? Observational studies, meaning researchers look at patterns in groups of people without intervening, have found an association between more frequent ejaculation and a lower risk of prostate cancer. For example, a landmark study that followed tens of thousands of men over decades found that those who ejaculated more often in their younger and middle years had a slightly lower risk of developing prostate cancer later in life. But it's important to understand what association means in science. Just because two things are linked doesn't mean one causes the other. Men who masturbate more often might have other healthy behaviors, better metabolic health, or simply be less stressed. All factors that could contribute to a lower cancer risk. While frequent ejaculation isn't a guaranteed protective factor, it's reassuring to know that current evidence doesn't support any harm. Now let's discuss prostatitis and chronic pelvic pain syndrome, conditions that affect many men and can sometimes be confused with prostate cancer. Prostatitis refers to inflammation of the prostate, which can cause pain, discomfort in the pelvis, and urinary symptoms. Chronic pelvic pain syndrome is a persistent pain condition that may overlap with prostatitis. How does masturbation fit into this picture? For some men with prostatitis or chronic pelvic pain, ejaculation provides temporary relief, possibly because it helps empty the prostate and reduce local congestion. For others, ejaculation can briefly flare symptoms, likely due to heightened nerve sensitivity or local irritation. It's a highly individual response, and there's no evidence to suggest that masturbation causes or worsens prostatitis in the long term. If you have symptoms like pelvic pain, it's best to pay attention to your own body's signals and discuss them with a healthcare provider. What about benign prostatic hyperplasia, or BPH, the medical term for non-cancerous enlargement of the prostate? BPH is very common as men age and can cause symptoms like a weak urine stream, frequent urination, or difficulty emptying the bladder. Some myths suggest that masturbation causes the prostate to swell or enlarge, but there's no scientific basis for this. The main risk factors for BPH are age, family history, and metabolic health, things like obesity, diabetes, and cholesterol levels. Masturbation doesn't appear to increase or decrease the risk of BPH. Let's address some common myths. One is that abstaining from ejaculation somehow preserves prostate health, while frequent masturbation depletes vital fluids or causes damage. These ideas have no support in modern urology or endocrinology. The prostate is designed for regular activity, and periods of abstinence aren't necessary for its health. Another myth is that masturbation increases the risk of prostate infections. In reality, most prostate infections are caused by bacteria entering the urinary tract, not by sexual activity. So, what are the real signs and symptoms that should prompt you to seek medical help? If you experience pelvic pain along with fever, burning when you urinate, blood in your semen or urine, inability to pass urine, or symptoms that last for several weeks, it's important to see a clinician. These can be signs of infection, inflammation, or other serious conditions that require prompt evaluation. What about practical habits for long-term prostate health? While the science doesn't point to masturbation as either a risk factor or a protective factor, there are proven strategies to support prostate wellness. Maintaining a healthy weight, staying physically active, eating a balanced diet rich in fruits, vegetables, and healthy fats, and managing chronic conditions like diabetes and high blood pressure all contribute to lower risk of prostate disease. Regular checkups with a healthcare provider, especially if you have a family history of prostate problems, can help catch issues early and provide personalized guidance. For older men, regular screening for prostate cancer can be part of preventive health, especially if you are at higher risk due to family history or genetic factors. Screening typically involves a blood test called PSA, prostate-specific antigen, and sometimes a physical exam. Discuss the pros and cons of screening with your doctor, as recommendations vary based on age and risk factors. It's also important to remember that sexual health is part of overall well-being. Masturbation is a normal, healthy activity for most men, and there's no need to feel guilty or worried about its effects on the prostate. If you have questions or concerns, talk openly with a healthcare provider. You're not alone, and your concerns are valid. In summary, the take-home message from current science is clear. Masturbation does not cause prostate damage or disease. In fact, more frequent ejaculation may be associated with a lower risk of prostate cancer, though the relationship is not proven to be causal. Responses to ejaculation in prostatitis or chronic pelvic pain vary, and BPH is unrelated to masturbation. Focus on overall healthy habits, stay alert to red flag symptoms, and seek medical advice when needed. This explainer aims to provide balanced, doctor-friendly information based on the best available evidence. If you found this helpful, consider engaging with the community, sharing your questions, and staying informed about men's health. Remember, this content is for educational purposes only and is not medical advice. If you are in the UK and need urgent help, contact your GP or NHS 111. Prostate health is a journey, one best navigated with clear information and trusted medical guidance. Take care of yourself, stay curious, and know that your questions matter.